Welcome to Transcultural Communications, Working with and Without an Interpreter, Chapter 10. Communicating with patients from different cultures is often complicated by language differences. In the preceding sections on communication, we primarily discuss situations in which patients and the medical professional spoke and understood the same language. Medical professionals face a far greater challenge when they try to communicate with patients with limited English proficiency or with no proficiency in English. Unless you learn ways to overcome language barriers, your customary assessment and teaching skills will be seriously hampered, and the patient's care may be compromised. This chapter describes the important role of the medical interpreter and outlines specific techniques for working with and without a medical interpreter when assessing patients and providing care. A medical interpreter is a specially trained professional who has proficient knowledge and skills in 2 languages and employs that training in the health-related setting in order to make possible communication among parties using different languages. An interpreter's code of ethics was developed by an interpreter coordinator in Seattle. This included confidentiality, accuracy, content, and spirit of what is said word for word because exact interpretation is not always possible, completeness, and convey cultural framework, be non-judgmental, and do not influence the opinion of the patient. Furthermore, the interpreter code of ethics involves ensuring a trusting and respectful relationship. If a conflict of interest exists, the interpreter should withdraw from the assignment. Compensation, which is no tipping or favors. Be honest about skills, avoid ethical violations, and practice professionalism. It's a good set of ethics. However, there are no standard expectations placed on interpreters unless the hospital itself has that as part of the agreement. In the 1990 census, 13.8% of the people in the United States spoke in a language other than English. Spanish was the most frequently spoken language at home, and in some states, percentages of persons speaking another language were higher than the national norm. The Department of Health and Human Service Office of Civil Rights states that an individual may not be denied an interpreter when seeking or receiving treatment at a healthcare facility that receives federal funds. Often this law is hard to enforce because of the severe shortage of trained medical interpreters. Also, few people who don't speak English know to file a complaint. Many grave problems involving quality of care can arise from miscommunications due to language barriers between patients and healthcare practitioners. Some of these problems include the following: misdiagnosing patients, non-compliance with treatment plans because they didn't understand the instructions, patients agree to procedures without understanding the ramifications, they do not seek preventative care, and experience severe frustration with the process. When interpreters are not available to facilitate communication between non-English speaking patients and providers, not only does the quality of care decrease, but the cost of care increases. Costs can escalate for the following reasons. The cost of care escalates when an interpreter is not available. They do not use preventative care, which means that the patient waits until treatment is necessary and usually more expensive. They're unable to get information from the patient so doctors rely on expensive and extensive tests to make a diagnosis. Effectiveness of medical treatment takes 50% longer because the patient doesn't understand what they are supposed to do. It also causes multiple repeat visits, missed appointments, and complaints from insurance companies that have to be addressed and followed up on. If you have never worked with a professional interpreter before, you may initially find the process difficult because you are relying on another person for your collection of verbal data. Remember that clients may not express the need for interpretation, so you need to offer interpreter services. To receive the maximum benefit from the interpreter's services with the least amount of frustration, follow these guidelines. Schedule an interpreter who is the same gender and of a similar age as the patient if possible. With Asians, older interpreters are better because of their overwhelming respect for elders. Build rapport and trust with the patient non-verbally before the interpreter arrives. Don't ignore the patient. If possible, meet briefly with the interpreter to discuss assessment strategy. Step out of the examining room to do this. Ask interpreters' opinions on how to discuss sensitive topics for sexuality. Speak to and face the patient. The interpreter will follow their own protocol for where to stand and maintain eye contact with the patient. Furthermore, do not make comments about the patient in English to the interpreter that the patient should not hear because they may understand certain words or phrases. Talk about one symptom at a time. All time for translation and answering. That should be allow time for translation and answering. Avoid idioms. Phrase your question in short, easy sentences. Use basic words. Pay attention to the patient's nonverbal body language and their tone of voice. If the patient speaks at length to the interpreter, but the interpreter offers a too brief comment, follow up with the interpreter. Be aware that not all interpreters are ethical, and review assessment with the interpreter. Although you should always try to work with a medically trained interpreter, one may not always be available. The best option is to use a bilingual coworker. A telephone interpretation service, for example, AT&T has a 24-hour service for interpretation of 140 different languages. The drawback is that this service is very expensive, and they don't always understand medical terminology. And your last option could be family members. However, problems with using family members, especially young family members, can include the following: being too young to know terms in his native language for certain conditions, being embarrassed by words his grandmother uses or the belief she voices, not interpreting everything that is said, be put in a difficult situation since interpretation is usually a high status position reserved for adults. Avoid putting a child in a situation where they must deliver bad news. People may be embarrassed about disclosing information in front of a family member. And family members may change the patient's explanation about something that they don't want anyone to know. Occasionally, you may not even have a family member or a bilingual employee to interpret for you. What should you do to communicate with your patient while you wait for an interpreter to arrive? If a patient understands a little English, you may be able to gather useful information without an interpreter by following these guidelines. Greet the patient respectfully, be polite and formal. Try to identify the patient's primary language. Identify if the patient speaks a second or third language. Many Asians speak French. Speak slowly, clearly, and quietly in English. Do not shout. They don't speak English. They are not deaf. Avoid appearing frustrated or irritated, and use body language to assess a patient. Hover your hand over certain areas of the body.